It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Hey everyone, Namaste and a very warm welcome to all of you. This is Vidya Malavde and I'm super excited to be a part of this one-of-a-kind live health hour show, which has helped so many viewers connect with leading Apollo experts even during the most difficult times. Through the Health Hour, Apollo 24/7 aims to bring the best doctors from Apollo Hospital to your homes every Sunday so that you can discuss your health concerns and get answers to all of your health-related queries live. And if you want to avail the entire range of services by Apollo Hospitals from the comfort of your home, I strongly urge you download the Apollo 24/7 app. Here you can book virtual consultations with the best Apollo doctors, order your medicines online, and even get home sample collection for your lab tests, all with Bus Ek Tap. Let me also tell you about the wonderful Saving a Child's Health initiative, that is SACHI, by Apollo Foundation that aims to provide the best pediatric care to children in need at no cost. If you wish to know more about it, please check the link in the description box or scan the QR code on your screen. Coming back to the show today, we are here to discuss a very important topic, COVID and vaccination. So what's new? I'm sure all of us have many questions like, can children get COVID vaccine now? How effective are the new vaccines? And is a booster needed after the second COVID vaccine dose? To answer all of these and more, we have Dr. L. Sundararajan, Senior Consultant Pulmonologist at Apollo Hospitals Greams Road, Chennai. He's here with us today. So start typing your questions and we'll take them up with Dr. Sundararajan one by one during the course of the show. Also, don't forget to watch out for the quiz right after the live Q&A session, where you can win exciting gifts, discount vouchers, and much more. So well, here we are today. We've got Dr. L. Sundararajan. Dr. Sundararajan has over 20 years of experience in treating severe respiratory ailments, studied MD General Medicine from Madras Medical College, 1997, a member of the Royal College of Physicians, UK, 2001, postgraduate certificate in medical education, Cardiff University, 2009, trained and worked as respiratory medicine specialist in UK from 2001 to 2008, author of several papers in national and international journals. So here I am with great pleasure and honor. Really want to welcome Dr. Sundararajan. How lovely to have you with us, Doctor.
Namaste.
Thank you so much
Good morning.
for joining us today. Good
Thanks,
morning,
Vidya.
Doctor.
Thanks for the kind introduction. Thank you.
So I'm just going to get into it. First of all, I want to ask you, so COVID vaccinations, please tell us the benefits and also the side effects.
Yeah. See, from the beginning of this year, we have started vaccinating, and we've got at least 3 vaccines now currently. And the benefits of vaccines obviously are, because in the fight against COVID, we either need two types of immunity, either natural immunity or artificial immunity. Natural immunity is where you get, once you get infected, whereas artificial immunity, it can generate immunity by giving vaccines. And in that sense, the vaccines that we have got very good efficacy, very good efficiency in protecting you against, developing active COVID infection. The important benefit is that they may not they may not give you 100% guarantee, they may not foolproof guarantee against developing an infection. But even if you develop an infection, it tends to be, the studies have shown that the infection tends to be mild and, not very serious. So definitely mortality and severe COVID illness can be prevented by vaccinating yourself. And the risks are very minimal. If the risks and side effects are very minimal, and people have allergies to vaccines, you should consult your physician before getting yourself vaccinated. Otherwise, most people don't have any serious side effects from the vaccines.
Okay, that's good to know actually. But what about these newer vaccines that are coming in now? They're on the horizon, right? We've been talking about new vaccines as well for children and adults. So how good, or can you talk about them as well?
Yeah, the current vaccines have been tried out in people who are more than 18. So the adult population, that's what we are trying to cover in the current vaccination drive. So ones that are available definitely are tested and proven to be safe and efficacious in this group. We don't know yet about the under 18 or under 12, definitely. In the childhood, we don't know the efficacy of these vaccines, but definitely some are on the horizon. You know that there is a DNA vaccine which is being produced in India by Citus Carilla. This is a DNA vaccine compared to the other vaccines, which are mRNA or adenovirus vaccines, so or live inactivated vaccines. This is a DNA vaccine. This is one potential candidate, and the others are also on the horizon. There is a nasal vaccine which is coming up, the same as Covishield. The same Covishield is being could be coming in the future as a nasal form, which is very easy to administer for children, just like your the polio vaccines and stuff like that. So like oral polio vaccine, the ease of administration is much less. So you don't need an injection, unlike Covaxin or Covishield. So these are the things that are on the pipeline.
Oh, wow, that's nice to know. So doctor, tell us about this long COVID syndrome. What is long COVID syndrome?
Yeah, see, long COVID syndrome is one, we know that people who had COVID, most of them recover within 2 weeks' time. So acute COVID, they recover within 2 weeks' time, either at home, if it is mild, if it is moderate or severe, they get hospitalized, get treated, and then go home and recover fully. But we know of late we have been observing that many people are not recovering fully. The symptoms tend to linger on for quite some time, sometimes weeks to months. So the most common symptoms that tend to persist are fatigue, muscle pains, tiredness, headache, malaise, but more importantly, cough and breathlessness, which are symptoms related to my field, and also some other serious problems, also like cardiovascular problems as well, and also neurological symptoms like forgetfulness, muscle weakness, and those kind of things. So these can be persistent, and these tend to be more common in people who have got severe comorbidities like other coexisting illnesses and who stay in the hospital for a longer time. So the longer you stay in the hospital with an acute COVID infection, your chances of developing long COVID or long effects after COVID are more common.
Okay, so that basically is long COVID syndrome. And what about the effects of COVID or the long-term effects of COVID on our lungs as well? Because I guess apart from the other organs, the lungs are the majorly affected, right? I heard somewhere that it causes the atrophy of lungs and things like that. So how true is that, and how do we do that?
That's a very important question to know, because we know that COVID itself, the important most important organ to be affected is the lung. People who get severe COVID, they usually have problems because it affects the lungs. The reason for that is the COVID virus itself, the protein of the COVID virus, it attaches to receptors in the body, and unfortunately these receptors very abundant are in the lungs. So it's a very convenient route for the COVID virus to get itself attached to the lungs. It spreads through respiratory droplets. So it spreads through the respiratory, by coughing or sneezing and things like that. So spreads the respiratory droplets through the upper airway, and then it goes into your lungs. Once it gets attached to the lung, then it causes a very severe inflammatory reaction in some people, causes a very severe inflammatory response. Thereby, you develop the severe effects of COVID in the acute phase. But what happens in the recovery phase? But we notice that many people who recover from COVID, once they have had a COVID pneumonia, particularly the severe ones, they tend to develop what we call scarring in the lungs. The areas which have been affected by the COVID in the lungs get scarred. The scarring can cause long-term damage. So it can cause long-term effects on the lungs. So people can become breathless, they can have cough, they can become breathless to the extent that they may require oxygen at home. Sometimes, in very occasionally, it can become a long-term disease. It can become a long-term disease. Although we have to know that we know this disease only for the last 2 years. So how this is going to pan out, we don't know yet. So we need to watch out the space.
Oh, okay. So, I mean, we really need to take the precaution for it to not become this long-term sort of a thing.
Yeah.
And is there anything that we can do for it to not
Yeah.
become this long-term disease? Is there anything that we can do for our lung health?
Yeah, there are two things. Who develops these long-term effects of post-COVID, what we call post-COVID fibrosis, lung fibrosis. There are certain independent risk factors for people to develop post-COVID lung fibrosis. It tends to be more common in the males. It tends to be more common in smokers. It tends to be more common in people who had other comorbid illnesses, like it could be diabetes, hypertension, heart problem, kidney problem, and most importantly, it tends to be more common in people who have had a severe COVID illness, thereby requiring ventilatory support or invasive intensive care unit support. Those kind of people tend to have a higher risk of developing post-COVID fibrosis. So to prevent it, we need to get yourself treated early, promptly, and then you need to watch out for your the recovery phase. Also, you need to kind of involve chest physiotherapy and do more physiotherapy, and so that the recovery phase is quicker. And there are certain medicines also which can help you along, but these medicines have a limited role. They don't have a very curative role, but they can stop you from developing more severe scarring.
Can we predict these effects on our lungs already? And you just told us how to prevent it or treat it, but can we predict this?
Yeah, these are the things that the people who are the patients who develop who have severe COVID pneumonia and who are on oxygen support, who are on intensive care unit support, who are on ventilatory support. These are the people who need to be closely followed up. These are the people who are likely to develop COVID fibrosis. So they need to be followed up by the respective physicians or pulmonologists so that they can keep an eye on them, maybe by repeating scans and doing lung function tests. Thereby you can watch out and see and assess the patients properly to see whether they've developed fibrosis or not.
Right. So basically, what is lung fibrosis and how do you identify it and then how do you treat it?
Yeah. Lung fibrosis can be due to several things. Now we are talking about lung fibrosis now in the setting of COVID. We know lung fibrosis is is not a very rare disease. It affects the lung interstitium or lung tissue as such, not the airway, not the breathing pipes. It affects the lung tissue as such. So the lung tissue is very important for carrying your oxygen into the body. So that's why people with lung fibrosis develop low oxygen levels and they become breathless and cough and all those symptoms. Lung fibrosis can be due to several factors. Smoking is an important factor for that. And other than that, dust exposure, including dust like asbestos, and then sometimes pets like rearing pigeons at home, birds at home. These things can also lead to lung fibrosis. And there is a whole range of conditions, called rheumatological diseases or joint diseases. These also have an effect on the lungs. People with rheumatoid arthritis, systemic lupus, these are all rheumatic problems. And these patients also have a higher risk of developing lung fibrosis. And there is an entity where we don't know the cause. There is a distinct entity where we don't know the cause. It's called idiopathic pulmonary fibrosis or lung fibrosis where the cause is not known. They can be very severely affected and they can end up in serious problems. They can have a lot of complications and they can develop poor respiratory reserve, poor respiratory function, and may become dependent on oxygen. There are drugs to, of course, treat it, but sometimes, unfortunately, drugs are only, they have only limited effect. they are candidates for they are potential candidates for lung transplantation. Lung transplantation is perhaps the only definitive cure for lung fibrosis, irreversible progressive lung fibrosis.
Oh, okay. Wow. So I actually didn't have an idea about like something like an RA or rheumatoid arthritis, which is like a autoimmune disorder, which can actually
Yeah, it can.
get
Yeah,
into a lung fibrosis at some point.
yeah,
Wow.
yeah.
Okay. And what about lung health? How do we first of all maintain our lung health?
Yeah. See, when we talk about lung health, it's important to know that lungs, see, unlike I used to tell my patients, unlike the heart, the more you exercise is good for the lungs. When you have a heart ailment, when you have a coronary artery disease,
Right.
there are certain limitations on your exercise. You need to go on a treadmill, find out what is your exercise levels. You don't exercise too much, because if you exercise too much, it can put strain on the heart. This is perhaps
Right.
exactly the reverse in terms of the lungs. The more you exercise, the lungs can function better. So, it's not that, I'm not saying this to everybody that, people with severe asthma and everything, but, if you want to keep a good lung health, keep exercising, take up some exercise program, whatever is feasible for you. It could be just a simple walking 30 minutes, brisk walking 30 minutes daily for 5 days in a week, or take up whatever
Right.
exercise, swimming, any kind of exercise is good for the yoga. All these things can, improve the breathing, because, lungs basically do the breathing. Unfortunately, we forget, uh, we don't have to consciously breathe. Breathing is a very very involuntary thing, but we
Right.
don't look at it from that side. And people who get breathless, or actually sometimes you find that after you do a thorough assessment, you find that it is not due to any physical illness. Actually, it's due to physical deconditioning, because you've not
Right.
exerted yourself to experience what is breathlessness. So once you experience
True.
that, the lungs automatically, can the healthy lungs can actually work better, and then can generate, make sure your oxygenation is fine. So, so that's one important thing. Exercise is very, very important. Second thing is that, of course, smoking. We know about smoking. We can talk about that as well.
I was just going to come to that only. Yes.
Yeah, yeah.
Yeah. What are the ill effects of smoking on the
Yes,
lungs? I was
of course.
going
Yeah,
to say that. Yeah.
smoking definitely is not at all a good idea. You want to keep healthy lungs. So, as we told before, it increases the risk of lung fibrosis. It causes COPD. It has, very clear association with lung cancer. There's no doubt about that. Apart from lungs, it has got telling effects on all the other organs in the body. It increases the risk of coronary artery disease, including heart attacks and strokes,
Right.
and, several other cancers, including esophageal cancer, pancreatic cancer, and so on and so forth. So I think smoking has got a lot of ill effects, and the earlier you quit, better. It's never too late to quit. Whenever you quit, the lungs start recovering. So you will recover. You may not recover the lung function that you've lost due to smoking, but then, you will,
You're not deteriorating it further.
cannot deteriorate any further. Yeah.
Correct. Right. Yeah, correct. So basically, I think smoking is something that you must give up, and you must start exercising, I think, because that can build your lung capacity. And here's
Yeah.
something that I would really like to add up is, like you mentioned, yoga. I think pranayam does that also very effectively. I think that's a part
Yeah.
of my daily practice, and that is something that I promote vehemently all the time.
Yeah.
So yeah, that's something that we can look at. Now I have so many questions coming from all our viewers. Now here's the first one from Ms. Sri Hari Alavala. Is a booster dose needed after the 2 doses of Covaxing or Covishield? I think a lot of people are asking us that.
Yeah, that's a very important question. See, the short answer to that is, so far there is no scientific evidence to support the use of booster dose, because, see, you need, as I told before, you need natural immunity or artificial immunity by vaccination. Once you have vaccinated yourself, you will have antibodies, hopefully. And unfortunately, either because of infection or because of the vaccine, due to the vaccine or due to infection, your antibody level will start to wane. It will start to drop down. How soon it drops down, how much it drops down is still a matter of debate. So whether by giving a booster, the whole argument is whether by giving a booster dose, can we keep this antibody level, can we sustain this antibody level at a certain level, so that, you protect yourself from developing an infection. I think there's no studies to date showing a beneficial effect of booster dose. The countries who have vaccinated their adult population effectively, for example, like Israel or Germany, they have started doing booster doses for the third dose for their already vaccinated people. But you have to remember that the more people, it's important to vaccinate more and more people. Now that we have not even vaccinated, not even vaccinated 15% of our population. So we have still a long way to go. I think the stress should be on vaccinating as many people as possible with 2 doses, complete COVID vaccination for all the people, so that the whole population is protected. That is more important than just stressing on booster dose. And again, if booster dose itself becomes available after some guidelines by the World Health Organization or health bodies, there will be there are issues around that as well. So who do you give it to? You don't necessarily have to give it to everyone. So you have to identify the vulnerable or high risk population and then give it to them. So that would be more rational use of a booster dose rather than just opening up a booster dose for everyone. So when I say vulnerable population, I probably mean people who are on immunosuppression, people who are, for example, have organ transplant, they are on immunosuppression, cancer patients who are on immunosuppressants, or elderly people who can't mount a very good immune response, or people with a lot of comorbid illnesses, or otherwise healthcare professionals who are at constantly exposed to COVID or doing COVID work. So these are the kind of the population who should be targets for booster dose rather than rolling it out on a general basis. That's my view.
Okay. Next question here. Again, I think everybody is asking about booster doses, but well, here is it's a question from Mr. Ullas Krishnan. Is it safe to take a booster dose after Johnson & Johnson after 2 doses of AstraZeneca? I hope I've spelled that right.
See, I don't. Johnson & Johnson is a single dose vaccine. So once you've taken AstraZeneca is similar to our Covishield. That's a Covishield vaccine. So I think if your antibody, check the antibody levels. I would recommend probably if you check the antibody levels, if they are reasonable, then there's no point in taking another booster dose. Perhaps I would delay it if possible by 6 months to maybe even a year later before you think about a booster dose, because whatever protection you have will last for at least 6 months from a vaccine. So after that it starts waning. So that is perhaps the better time rather than taking it soon.
Oh, okay. So basically, at least a 6-month gap after the second dose is over is what you're saying.
Yeah, this question actually it's about mix and match. This mix and match thing is also not been addressed at all. There is no scientific data to say whether it is safe or not. I cannot say that because I don't know the answer to that because it's not been answered. In fact, they are looking at doing studies to look at this mix and match. People who have had inactivated vaccine first dose, 2 doses, followed by a vector vaccine, adenovirus vector vaccine. So there is no data to suggest either way. So I can't, I don't know the answer to that. That's the honest thing. Whether it is safe to give or not, I don't know the answer. But even if a booster dose becomes available, I would rather delay it as much as possible. Maybe 6 months or a year later, you may need a booster dose. It may come to that at some point.
Okay. So there's another question about the booster dose again from Lalita JS. Do we really require booster dose in spite of being fully vaccinated? If yes, then why?
Yeah, I think I probably answered that. Not everyone needs a booster dose. The booster dose, the whole idea of vaccination is to induce immunity, to produce enough antibodies in the body, in your circulation, so that it can, it can deal with any future virus infection. Basically, what the vaccine does is it stimulates your immune system to generate a pool of memory cells. Like these are all memory cells, and these memory cells remember the virus protein. They remember the virus protein, and since if they are attacked again, they will mount a quicker response, so that the next time around your immune system's response will be much quicker than the first time. the first time your body is not immune at all to the virus. This new virus is entirely a new thing. So your body, your immune system doesn't know how to tackle it. So that's why you suffer from all the infection related issues. But once your body has already known, your immune system has identified this virus protein, the next time around it will actually, it will stimulate a, very good, boost a very good immune response. Again, this is another question. So if somebody has already had a infection and then you also got vaccinated, there's probably not much role for a booster dose. So there is another school of thought where they are saying that the booster doses should be given to only people who have had completed the vaccination, but they've not had one virus infection as such. They've not been infected.
Right.
So those people will benefit better than, or benefit more, rather than people who have already had an infection and had full vaccination also.
But
So the mix and
doctor,
match
what do
is
you
not
think?
necessary.
Mix and match should
We
not happen.
don't
is what you're
know.
saying.
We don't know the safety of that yet.
We don't know. Correct,
We
of
don't
course,
know.
the safety of it. So this question is from Karedi Sweta, and she's saying that my mother is suffering from cervical cancer. She has undergone radiation. Can she still take the vaccination? Are there any side effects or precautions?
I don't think so. If particularly, I think it's very important that somebody like her takes the vaccine, because once you have cancer, you're vulnerable. So they should be more protected. I think having radiotherapy itself, there's no evidence to show that these things affect the efficacy of the vaccine, or they lead to more side effects. There's no evidence. So in fact, you should go ahead and get the vaccination.
She should go ahead, obviously, right?
Yeah.
Absolutely. I would think so too. Okay, this is another question we've got. I have sugar. Can I take COVID vaccine or not? Tell me.
Please go ahead and have the vaccine, because you probably should be in the first in the queue. So I think people with comorbidities, we have been from the last 2 years. We know that people with comorbidities, people with diabetes, people with blood pressure, heart problems, kidney problems, they are the ones who suffer the most, and they are the ones who get the serious illness. So it is better. Yeah, definitely you should go ahead and get yourself vaccinated. Other thing to remember is diabetes itself reduces your immunity. So the likely, if you develop an infection, you are less likely to mount a very good immune response. So you should get this protection, definitely.
Absolutely. So the next question is from Mr. Raj R. Hello, doctor. What is the difference between mRNA vaccines and Covaxin or Covishield vaccines?
Okay, that's a very it's probably a technical question. See, this virus is an RNA virus. It's an mRNA virus, basically, which means that this virus cannot replicate without DNA. So it does not have a DNA. It's an mRNA virus. So what it does is it enters the host, which could be either bats, it could be pangolins, it could be humans, mammals, whatever. If it enters the host, it uses the host DNA to replicate. So once it attaches to your body, the respiratory system, there it gets hold of your DNA and replicates. So then only the replication starts. So it cannot replicate outside your body. So being an mRNA virus. So what the mRNA vaccines do is this is a very new technology. Pfizer and Moderna, they're all mRNA vaccines, as rightly pointed out. They give the mRNA itself to use you to vaccinate yourself, and then the mRNA protein triggers your immune system to develop antibodies. So that's how the mRNA vaccines work. The other virus, the vaccines, so Covishield is a vector virus. It's what we are doing is the COVID virus has got a protein called several proteins in its membrane. One of the important proteins is the spike protein. It's called S protein. This is the culprit for most of the damage which it does to the lungs. So what the Covishield does is that they take this S protein and they mount it onto an adenovirus, which is a common cold virus. They mount it on a adenovirus and they give it as an injection. So actually you're getting an adenovirus infection with the Covishield. So that's why it's adenovirus normally enters to your nose and causes common cold. Whereas here they are giving it as an injection, so you will have some effects like cold like effects you will have, because actually you are actually being infected with a cold, it's common cold like thing. So that's why you will have some flu like illness, some fever, and all those things will be there. So again,
Right.
this S protein itself is injected, and the S protein then goes on to generate or trigger your immune system to develop antibodies. The DNA
Right.
virus is a new thing. The DNA virus is the current one, the which we are already has been approved now. The Sidus cadila virus, that is a DNA virus. There again, the DNA they're using the DNA recombinant DNA, not recombinant DNA they're using, and again they are mounting the S protein on top of that, and they are giving it as an injection. One of the advantages of the Zydus codila vaccine is that it's not an injectable thing; it's an intradermal thing. Unlike intramuscular, Covishield, Covaxin, they're all intramuscular, whereas this is an
Correct.
intradermal. It's like a needleless injection.
Okay. Okay. Fair enough. The next question we have is from R.S. Gupta, sir. What are the precautions for asthma patients who are going to get vaccinated?
See, I see this I can answer as a generic form. So whatever your comorbidities are, it's very important that we have realized over the past couple of years. What we have realized is that whoever has got any comorbidities, when you develop COVID also, it's very important to remember and optimize the treatment for your comorbidities. For example, somebody with diabetes developing COVID, one who has a well controlled diabetes and developing COVID, they actually have a better course. They do well, do better than somebody whose diabetes is poorly controlled and develops COVID. So the important
Right.
message here is that whatever your comorbidities, it could be blood pressure, it could be asthma, it could be diabetes. You take care of your primary illness and control it properly during that time, at least, so that you can you can have the COVID can not do much damage to you. Same thing for asthma also. Make sure you take your inhalers regularly, because the other problem with asthma is that many of the asthma symptoms uh, will mimic COVID. So you will have
Correct.
cough, you will have breathlessness, so you won't know what is causing what. So it's very important to keep your asthma under control. So at least you can make the doctor can make a distinction whether your symptoms are because of poor control of asthma or it's because of severe COVID. So very important to take your asthma medications as per your doctor's advice, and then you will have a fairly reasonable
So
course through the illness.
basically, yeah, whether it's asthma, diabetes, or any other comorbidity, the COVID vaccination is a must. And of course, you should be treating and taking care of your comorbidity as well,
Yeah,
along with that, is what you're saying.
yeah, yeah.
Exactly. Absolutely. The next question we have is from Mr. Krishna Harshit, and he wants to know what is the tentative date for the availability of vaccines for the children of ages 12 to 18. I think the Zydila COVID, COVID-D is whatever,
Yeah.
that's the
Yeah. The
that's
Sidus
currently coming
COVID,
up.
the Sidus cadila vaccine is probably very potential
Zydus.
candidate. Yeah, Sidus cadila. That is in Ahmedabad. It's from Sidus cadila and Sidus. That's a DNA vaccine. So the advantage of that is it's going through the approval process. I think it should be available soon. I would have thought. I don't know where we are in terms of the approval process. So the advantage of that is, since it's not an intramuscular injection, it's a intradermal, so it's a very painless injection. The other candidate is also about the nasal vaccine. That will be the probably the game changer in terms of the pediatric vaccination. So once it comes to that, is actually the same as Covishield. Covishield in the form of a nasal spray that is also being manufactured here. So once it goes through approval process, they have to go through phase 2, phase 3 trials, and then they come out with the result, and the DGCA will hopefully give approval for that, at least EUA or emergency use authorization. If it comes through, then that should be rolled out, I think.
Right. So here's another question from Ashwini Sehgal. I am in the service industry and keep moving all across India. What should I do to stay safe? Should I go for the booster dose? I think which we've answered a bit, but yeah, what are the precautions actually? Is what we all want to ask, because even for me, I mean, we travel all over the place all the time. Every week, I'm in a different city. We're traveling by air, closed environment, and just so many people, even when I'm shooting with. What are the basic precautions? Of course, wearing the mask is a must for sure.
Basic
Um,
precautions don't change at all, because one thing we have to realize is that although we have to learn to live with the virus. So this virus has been around since 2020. This is not going to go away anywhere. It's probably going to be there. But what we have now, the advantage now we have is compared to 2020 and 21, is that we have effective vaccines now, and more vaccines are being tried, under trial or under processing. So we will more people will vaccinate. The we can break the transmission chain. The only way we can get out of this mess is by breaking the transmission chain. How do we do that? Either you get infected or you get a vaccine. So once you vaccinate everybody, there is no more person to there's no more people to infect. That's how the virus will die a natural death. So otherwise, this virus is not going to go away. Then it becomes from a pandemic, it will become like an endemic, and the waves, the clusters, the spikes, and all those we were seeing in the second wave. Hopefully, it will become a small ripple or a small wave, and that's how we can get rid of it. Till then, we have to keep adopting all these safety measures like masking, uh, hand hygiene, and all those things, keeping safe distancing and all those things. Of course, we have to have the livelihood as to start, and the vaccination is a big will be a game changer in terms of the starting the livelihoods. Starting every business as usual. Yeah, when it becomes business as usual, you have to remember the more people get vaccinated, the sooner we can get to business as usual. So that's a crucial thing.
So, doctor, this is just for my knowledge. I wanted to know. So, what you're saying is, of course, we all get vaccinated, but that doesn't mean that might not contract COVID. We might get COVID, but our effects might not be the same, the dangerous ones, and I might not go to the hospital. But if I do get COVID in that sense as well, again, I have to stay away from, and isolate myself, not go to work for the next 2 weeks or so. That still remains the same, isn't it?
Unfortunately,
Or
so
will I
yeah,
be?
because that will remain the same, because whether you get vaccinated or not, once you develop the COVID infection, you are part of the chain. You're part of you become the part of the chain. So you are again going to keep transmitting it to others. So you have to isolate yourself. As I said to you before, this is an RNA virus. It cannot replicate outside. It needs a human host to keep itself in the cycle. So
Right.
once you've developed an infection, you need to isolate yourself. That's not going to change, unfortunately.
Okay. Unfortunately, yes. So basically, the precautions just need to be taken, whatever is said and done, whichever industry
Yeah,
you're a part of. Your masking is very important. And then I
yeah,
think the COVID tests are very important. Like when I'm shooting every single week or twice a week, we have a COVID test that is taken regularly for all of us actors and even
correct,
the crew members. Because we're working with
correct,
so many people. But I guess
correct.
with offices and otherwise people, like she was just asking, in the service industry, the keep checking yourself on say a weekly or fortnightly basis would also become very important then, right?
It's very important. It's very unfortunately, it's very costly. But I think these are costs we have to bear. If you think about
Right.
it, vaccines are the most cost-effective way in terms of controlling this whole pandemic.
Yeah.
Whereas the other things that you are mentioning now, doing repeated PCR testing, is is really a costly affair. But the you will have to see the benefits of it. Otherwise, if you don't do that, then you can't keep the industry running, you can't keep the businesses running, you can't keep the livelihoods going. So I think there is a cost to bear for everything. But more people get
Absolutely.
vaccinated. That's a crucial thing. That's a crucial thing.
So here's another question from Ms. Wolfina Queen. Post COVID health issues, what can one do to get back to normalcy after COVID infection?
Yeah. See, this I told you the long COVID. This is I wanted to talk about long COVID syndrome also.
Right.
That's the beginning. We talked about it. See,
Mm.
basically, many of the symptoms of COVID are not very severe symptoms, like loss of taste, loss of smell, and fatigue. These things are common after any viral infection. Unfortunately, with COVID, it tends to linger on or persist for some time longer. There are serious symptoms also, like cough, breathlessness. These things can last longer. To the important the way to get rid of these things or get back to normalcy is by, as I said to you, get on top of your, optimize your management of comorbid illnesses, because those are also important. Forget about this. We always focus on the COVID. Once somebody develops COVID, their entire focus tends to be on COVID. They forget they've got diabetes. They forget they've got hypertension. They forget to control that. So you need to make sure that that's all looked after. And so that's why for this post long COVID syndrome, you perhaps need a kind of a multidisciplinary approach, not just one person looking after it. And I may look from the pulmonology side. I will look at the lungs. I will forget about what the neurological problems are. You'll be surprised to know that many people with COVID develop a lot of anxiety and depression. Anxiety and depression are very common after COVID, particularly those who have had severe COVID. So that again becomes almost like a disease. So they need psychiatric help sometimes. So the other crucial thing to do is to get back to normalcy. You take up some exercise, or whatever is possible, and do some regular exercise to get back to normalcy, particularly from the lung point of view.
Right. I think the depression and everything also can sort of get triggered by so much isolation that you have to do during the COVID treatment. And
Correct.
that's that I think can affect everybody and anybody as such, whatever
Correct.
age, really.
Correct.
So the next question I have is from Mr. S.A., who says, my wife is 3 months pregnant. She took her first dose in April. Now, can she take the second dose now?
Sorry, what vaccine did she take?
Hasn't mentioned the name of the vaccine.
Yeah,
but,
of course, Covaxin, you can take it within 28 days. Covishield, within 3 months, which is 84 days. That's the current guidelines. Yeah.
Correct. But I think even if she's pregnant, she has taken the first dose. I think it's imperative that she should take the second dose.
It is imperative they take it, yeah. Because we've seen pregnancy and COVID, they get really bad COVID. Yeah. So it can affect the outcome of the mother as well as the baby. So it is very important that they take
very important to be vaccinated. Absolutely. The next question is from Ms. Lalita GS, and she asks, is Covaxin safe for brain stroke survivor, 6-month-old? If yes, should Ecosprin AV75 be paused that day or day before, or continue with ongoing medication?
Yeah, the two questions. One, it's safe. There's no question about, we can go ahead and get the Covaxin. I wouldn't worry about getting Covaxin in somebody with a stroke. Second, the Ecosprin, aspirin and all that, there was initially some concerns about stopping aspirin before. Usually it's not needed. So we don't need to stop aspirin. If they're on warfarin, maybe it makes sense. Warfarin is an anticoagulant. It's a blood thinning tablet. So it's that you have to consult your doctor before you're stopping that, because what indication you're taking warfarin, that's very important. If for example, if you're taking it for a valve replacement, a prosthetic valve, stopping warfarin even for a day may be very harmful. So you have to be, because you may develop a stroke then. So you have to be very, very careful. You have to consult your cardiologist or put you on warfarin before doing that. Aspirin, you can continue taking. I don't think there is any major issue with that. Make sure that all that you may develop is that the injection site, you may develop a small hematoma, but that's very, very rare. You don't have to worry too much about it. It's a very minor effect of that. So I think that should not stop you from taking the vaccine.
Right. So the next question here is from Mr. Lokesh Kumar. Covishield, what to do if we miss the second dose validity date? Can we take the second dose even after say a couple of weeks after the due date is done?
Yeah, it's not, it doesn't matter. The second dose, have the second dose as well. Even if you miss it's not like a deadline. It only says after 84 days. Now currently they're not giving before 84 days. So after that you can have anytime you can have it. Yeah.
Absolutely right, of course.
Because we know that the first dose, one dose alone gives about 30% protection. If you have 2 doses, it gives about 70% protection. So don't miss the second dose.
Right. So here's another question from Mr. Krishna Kitur. How to prevent or avoid pneumonia? What precautions can we take?
Sorry, to prevent what?
Pneumonia.
Okay.
This is, I don't think it's
related to COVID. COVID itself. COVID pneumonia. It's COVID itself. The severe form of COVID causes pneumonia anyway. So you will have symptoms. You will have symptoms if you have very high fever, cough, and breathlessness as well at the onset. It's quite likely that you may have developed COVID pneumonia. So it's not important to do a scan at the starting stage itself. If your COVID test turns out to be positive, then you probably will need to get admitted if you have got all these symptoms, and particularly your oxygen levels are slightly low. You can monitor oxygen levels at home. The oxygen levels are low, lower than 94%, then you may need hospitalization, and then you'll have to treat proper treatment for COVID. So that itself will protect you against the ill effects of the pneumonia. But if you have cough, fever, breathlessness at the onset of COVID itself, or maybe few days after COVID, you test positive for COVID. If you have these symptoms, it's very, very likely that you have developed COVID pneumonia.
Correct. Now we have another question from Sai Shivani ji. Can I take Sputnik or Covishield as Covaxin is not approved by WHO? I've already taken Covaxin.
Okay. I don't know what is. I don't know that. I don't know what is the. Is that the question
So,
for
I
related
think
to
a mix
traveling?
and match of these vaccines
Yeah, I
is
said
what
initially itself the mix and match thing is not approved yet. There's no data to show whether what are the side effects, what are the benefits from mixing and matching. We don't know yet. We need to wait for more studies to show either way. So I would recommend. I wouldn't recommend
So,
mixing and matching at this stage.
I have a few friends actually who have taken the Indian, Covishield, and
Yeah,
then because they have been wanting to travel abroad and stuff, also taken, those the Pfizer vaccine, etc., etc.
Pfizer.
So it is. I mean, I guess it's
I
only
think
for travel purposes they've done.
Yeah,
So I'm
I
not so
think
sure.
people are doing it
Or
for convenience. It's not for any scientific reason. It's not based on any scientific data. It's not based on any approved studies as well. But the experts, the experts in the vaccination field seem to think no matter, people may not wait for evidence. People may not wait for governments themselves may not wait for evidence. They may roll out because everybody wants to play it safe. You know, it's a low risk venture. The risks, they know that the vaccination risks are low, but the advantages are huge. So I think more and more governments will start doing this. I suspect. I don't know, but there's no scientific evidence for that.
But having said that, Covaxin and Covishield that we've been taking in our country is as effective, or maybe even more, as I would say, to take care of the
Yeah.
infection,
The
to
interesting thing you
vaccinate
mentioned
ourselves
about this,
extremely
because there has been some
that.
studies looking, yeah, there's some studies looking at the efficacy of Pfizer against the mutants and the variants. In fact, Covaxin was found to be more effective against the variants, mutants than Pfizer. So there you go. What do you want? Do you want to travel? Is the travel main concern, or your concern is about getting protected against COVID, variants of COVID? So that you have to think about it. So I think the safe bet is we are probably one thing we have to understand is this is going to be probably we are going to be taking these vaccines every year for the next few years. That's my take on it.
That's what I've been wanting to ask you, and I've been waiting because there's so many questions. Do you really think that we are going to be doing this as a yearly thing for many years? Because
For some time till it becomes whether whether you take Covaxin or Covishield or Pfizer, that's all kind of immaterial. That will be determined by the predominant variant which is circulating, which is going around. Predominant, what is the
right,
variant, what is it, the virus also, you have to understand the virus also is clever. It will mutate, it will keep changing, so it will keep changing its
yeah,
pattern. So you will have to adapt your response based on that. So that is a very, very intricate thing.
dynamic.
So it's not about just taking, I have taken Covaxin, can I take it's not Sputnik, it's not like that. It's it has to be much more nuanced and much more
Absolutely.
scientific. So unfortunately, we are going to be taking one or other vaccine every year, probably the next maybe few years. Till the virus from the pandemic, it comes down to a next manageable level.
True, true. So here I have a few more questions. I'm going to go through them really quickly. I think the first one here is okay. Can someone with seasonal flu take COVID vaccine? Of course,
Of
yes,
course,
right,
yes.
doctor.
Now we are recommending to our COPD asthma patients to stop taking flu vaccine this year, because whatever virus you have, it's probably COVID. So you take the corona vaccine first, and then the flu vaccine can wait.
That's it. That hopefully that answers your question, Mr. Jai Singh Rai. The next one is from Mr. Jai Mukherjee. My wife, who is a lymphoma patient and has had rituximab up to Feb
Rituximab, yeah.
2020, yeah, shows no IgG antibody 6 months after second vaccine dose. Do we need to treat her as unvaccinated?
This is a very tricky area. I think these are the kind of people who booster dose might be a consideration. I'm
Helpful for.
just I'm just this is the when they talk about the day when they are doing research on booster doses, this is exactly the kind of people who may benefit from booster dose. So because
Okay.
they are not infected, they have had a potentially malignant condition, immunosuppressive condition, and they're on rituximab. So all this modulates your immunity. So and they're still not mounting immune response. They don't have antibodies. So these are the kind of people who potentially will benefit from booster dose. I think we
Right.
should reserve booster dose for people like her rather than
That
everybody going around and taking it.
Absolutely. Okay. The next question is from Ms. Jyoti Rani ji. What are the safety measures for teachers community, 2 doses vaccinated, when schools reopen for primary kids where social distancing is not really possible?
This is a very tricky problem. I know this is a
Right.
tricky problem. This is a very important problem for parents and children and teachers alike. I don't know the solution to that. At some stage, we will have to open up. I think that's what I think. Some stage we should open up, because once you're
Right.
vaccinated, probably potentially we vaccinate about 12 also. We vaccinate about 12, and you vaccinated your teachers, and then you have to go ahead and open up at some point of time.
Absolutely, I guess, and all the precautions remain the same as such, as
Yeah.
doctors mentioned. So here's another question quickly again. Thank you, doctor. Excellent insights. Please advise us on how long it takes to gain full normal breathing capacity after COVID hospitalization and discharge. It's been 4 months. I still have breathlessness.
Yeah. This is very important question. I am seeing in my practice, I am seeing many patients who recovered from COVID 6 months ago, 8 months ago, 9 months ago, and still breathless. But these are the people who developed what we call the lung post-COVID lung fibrosis. So we should be really looking out for these people, checking regular lung function tests, getting X-rays frequently to make sure that the lung changes have resolved and the lung function has recovered. There are medicines to treat that to some extent. Other than that, important things is to keep your immunity level, boost your immunity level, and do some regular exercise, pranayam, yoga, whatever, or aerobic exercise, any kind of aerobic exercise. Keep doing that. That's the only way to regain the function. Unfortunately, if you've had a severe COVID infection, it's quite likely that you can develop the post-COVID symptoms can also persist for longer.
Right. Okay, so one last question that I'm going to take now from Ms. Priya C. How do I know if I have the immunity after 2 doses of vaccine? How long will the body have the memory to fight? And are there any tests that I need to take to find out if my body has the ability to fight back?
We don't normally recommend checking antibody levels after 2 doses of vaccine. So we presume that you had immunity. But if you want to really check it, you can check your antibody level after, say a month, 3-4 weeks after having a second dose. That can tell you what your the antibody level is. But the antibody levels will wane either after natural infection or after vaccination. The antibody levels will drop. How soon it drops again? It's variable, quite variable. Can be anytime, 3 months to 6 months, sometimes a year. So, but it will drop. It will drop. But as I mentioned before, it's not just the antibody level. The vaccine or the natural infection or the infection itself, it leaves behind a pool of memory cells. There are memory cells. Your immune system has memory cells. Though they are there still. So that is not reflected in your antibody test. So those memory cells are still there fighting, ready to fight when there's a next bout of infection. So you should
Right.
depend on that more rather than just the antibody levels. The antibody levels can give you a small sense of kind of confidence, but there
Correct.
are more to it. There's more to it than just the antibody level. I wouldn't worry too
Wow.
much about checking the antibody levels.
Correct. I think worrying should just kind of stop a little bit. Take your vaccination and do your breathing, do your exercise, quit smoking. And these are the kind of high points that we've been taking. Doctor, I'm going to now ask you to come out with your top tips. Also, I want to know in your top tips, how can we prevent ourselves from the crisis that we went through in the second wave? What are the precautions? Your top tips.
Yeah, see, now that compared to 2020, we are in a much better stage now, because we have got more now effective vaccines, and we also learned a bit more about managing COVID in a better way. So important things is that, unlike the second wave where it hit us really badly, so now the important things to remember is that if you have any symptoms, please go and consult your doctor and get yourself checked out, either by telemedicine, or if you can meet your physician, really get yourself checked out, particularly if you have comorbidities, so that you get yourself treated early. So once you have tested positive for COVID, then it is very absolutely important that you stay yourself isolated, because that's the only way to break the transmission chain. But the most crucial thing is vaccinate yourself. Now we have got a very effective tool against the COVID infection. So to break this or to break the transmission chain of this pandemic, we've got a very important tool in our hand. That's the vaccination. So more people get vaccinated, it's impossible for us to get out of this pandemic quickly and get back to your normal life. Even if we go back to a normal life, which will happen, schools have to open up, businesses have to open up, and livelihood has to start. So all these things have to happen. So more people get vaccinated, it's easier for us, and for us to get back into a normalcy, as normal as possible. Once you to how to maintain lung health, that's another important question in everybody's mind. So take care of your illnesses. If you have any comorbid illnesses, take care of their illnesses, diabetes, hypertension, manage them adequately, optimize the treatment, take some regular exercise. Definitely quitting smoking is very important for people who smoke, and take whatever exercise is possible, so that you remain as fit, because exercise itself boosts your immunity. Exercise increases your immunity. So exercise, adequate nutritious diet, uh, quitting smoking, taking care of your comorbid conditions, and more importantly, vaccination. These things will hopefully help us, out of a situation where we were in the second wave. Thank you so much.
Thank you so very much, Doctor, for all of these insights. We're very, very grateful that you came on board today and, gave us this beautiful, answered all of our questions. So thank you again very, very much.
Thanks, Vidya. Thank you so much. Thank you. Very nice interacting with you.
Thank you, Doctor. Well, now it's time for the quiz. So hope you guys are ready. Let me give you a tip. Some questions will be easier to answer if you have the Apollo 24/7 app on your phone. So here's what you have to do. Answer the question over the chat. Winners' names will be announced at the end of the show. Winners to mail their contact details at marketing@apollo247.com, and gifts voucher will be shared with you. So without any delay, I'm going to share these three questions with you. Question number 1. When is the World Lung Health Day? Again, when is the World Lung Health Day? Question number 2. What is the full form of COPD? What is the full form of COPD? And question number 3 is, which premium membership plan of Apollo 24/7 provides you with the benefits like free delivery of medicines, 24-hour emergency doctor on call, and many more? Again, which premium membership plan of Apollo 24/7 provides you with benefits like free delivery of medicines, 24 hours emergency doctor on call, and many more? So don't forget, quickly answer those questions in the chat box. And before we move on to announcing the winners, I just want to make sure that all of you have gotten your COVID vaccines by now. If you haven't, please book your vaccination slot on Apollo 24/7 app by scanning the QR code on the screen, or walk to your nearest Apollo vaccination center to get your jab. What's more, by getting your second dose at Apollo, you can win exciting rewards like 150 rupees off on your first virtual doctor consultation, 10% on pharmacy orders, free Ghana membership, free Lens Card Gold membership, exclusive discounts, and much more. Make sure you encourage everyone around you to get vaccinated too. And in case you have questions about the vaccination or any other health concern, you can use the special coupon code HH247 to get rupees 199 off on your online consultation and 15% off on medicine orders placed on Apollo 24/7 app. So we are going to move on and let's see who our winners are. My technical team is just looking into the thing as to where we can find our winners. Yes, we finally got them. So here we are. Winner number 1, Tejinder Jit Singh Brar. Winner number 2, Vandana Venkat. And winner number 3, Raj R. Again, Tejinder Jit Singh Brar, Vandana Venkat, and Raj R. Congratulations, guys. Thank you so much for coming on board, for answering our questions, and also thank you each and every viewer for joining and participating. Hope you found this information shared useful and would follow the amazing tips shared by our doctor. We want to say goodbye here, but we will be back with another important topic and an Apollo expert next Sunday at 11 a.m. So stay tuned and keep wearing that mask to stay safe. Goodbye and God bless.